All right. Now, first thing should always be, well, I already put the bolster in. We have the bolster, we have the tummy pillow, and we have that tube. Now, I use another fleece blanket. That ends up being probably the one I would suggest the most for people, just because it's, you know, more squishy and the texture is nice. So that one's looping around. If you're standing at the head, it literally creates a U shape just like a face cradle, and then creates coverage on the lateral sides of the body. We're good to go there. We're going to revisit all of the various methods real quick. So just to keep me scripted, this will revisit a little bit of what we talked about last week. Static methods, you know, it is an actual method. Now, as I indicated before, you'll eventually get actually more than halfway into some of the, now we don't go into a full-on set of like energy-based protocols like polarity therapy, Reiki, chakra, all of that. We work out the principle of what do all those systems have in common. And all of them have in common basically just long, gentle holds. Some that may follow a particular pattern, most of which will tend to go clockwise. Clockwise rotations around certain regions, things like that. But even in the medical care system, there are systems of touch that are just about, usually like on just hands, things like that. They're very light and they are structured in such a way that they're the same every time, they don't change. So we can't undervalue the resting in contact. The way I use it in a practical sense is more as either a initiating sequence of contact applications over the sheet, and something that is conditioned in, that it feels like the same pattern of contact when I start the session, and also a similar series of contact points to end the session. Now, aside from that, you can go further into more of a, this would be part of oscillation. So we're jumping down to oscillation, because part of what we could include with this, it just transitions nicely, is going from static to something that has a bit more of a rocking nature to it. And with this, when there are attempts in some fields at how do you entrain to a person's rhythm, quote unquote, their biorhythm. And one is to create this rocking effect and see kind of at what tempo their body seemingly wants to rock at. I mostly show you that so that you know that that exists. I am more of a fan of, you know, not forcing the body, but kind of staying at more of a rhythm and sequence. And ideally, if you have music playing, which we don't have for this, but if you have music playing, both of you, the client and practitioner, will entrain to that, and you can kind of just match the rhythm of that. But rocking, and when we get to other ideas of movement, for like dropping down to, you know, around the bottom three of these methods, oscillation and movement, how do we incorporate some level of movement for the spine? The thoracic spine, which is encaged by the rib cage, doesn't have like rotation and a lot of mobility. The lumbar spine and cervical spine do. If I rock a person back and forth, although the head seems still, there are little rotations happening then at the cervical vertebrae. If I rock the pelvis or I rock the upper body, I'm also shifting that and causing little, I mean, they're subtle, but they're little mobility rotations at the lumbar spine. And since we have the person laying on the pillow, where now the disc space of the lumbar spine is decompressed, all of that, this rhythmic oscillation can be a sneaky valuable tool with how to get mobility for the actual joints of the spine. And by doing it rhythmically for an extended period of time, any kind of rhythmic oscillation, for done long enough, will reduce the tone of structures. It's like rocking a baby to sleep. You can either reduce the tone of the whole being, right? Or you could go more precisely to an individual area and shake and oscillate it. And that also, if done rhythmically for long enough, can overwhelm the structures and get them to reduce in tone. So just this alone, if done sporadically throughout the session, like I do it as I initially make contact, right? I'm kind of feeling, I come around, and then as I work, if I keep on sprinkling in these rocking actions, I'm getting a lot of secondary mobility, again, at the disc space and everything else related to the spine. It's one of those where it seems so simple, it's also incredibly gentle and safe, and if done throughout the session, may offer the extra little potential for benefit to occur, either specific to joints, but also through all this, we're influencing fluid movement. All right, so things like that seem like they're not really a technique, but don't underestimate them. Now, compression we've covered, right? Compression is just bleh. And we'll go more into gliding and kneading here throughout the session. Most of what we do is compression, gliding, and torsion forces like kneading. Shearing and friction forces, an example of that could be either I do friction directly over an area, maybe to influence the pliability of a scar or the tissue around a scar. If I have a more concrete example of this, it would be the metacarpals and metatarsals of the hands and feet. The structures in between here, you have intrinsic muscles and structures between the metacarpals and metatarsals. The only ways to influence those is to stabilize one of them and move the other one back and forth, creating a shearing and frictioning between those. So there's other areas where that comes into play, but those in particular, in terms of being able to help a person's hand and foot move better, there's stuff all in between here that's involved with, like, if a person's hand is starting to kind of turn more into a claw, or if their feet are becoming immobilized, these all get really rigid and tight. How do you influence it? Shearing and friction. And you've heard it. All right. Elongation. The factor here is that stretching is part of elongation, but it is not, that is taking it to end range. Okay, so elongation can be this structure. If I move the ankle this way into plantar flexion, these structures here on the posterior side of the ankle and calf are now short, right? Now, if I do this, they become longer. I can go from here to here to here, all the way to a stretch. But a stretch is elongation at end range. Elongation can be, all right, the structures of both the posterior lower leg and upper leg, the calves, the hamstrings are short now they're long. So as part of movement, reflecting on, ideally if you just do movement everywhere, what you've done is elongated a structure, shortened a structure, elongated the opposite structure, shortened the opposite structures. So just the definition of elongation versus stretching. Try to hear it again. We covered oscillation. Further to that is the idea of shaking. So I can shake very directly. I can just grab with my hand on the tissue and see if I can mobilize a very particular. Now, this would also create shear effects. Knowing the anatomy, as you move forward, I know there's surface muscles that become the Achilles tendon, and then there's ones underneath of those that travel kind of through this little tunnel space, think kind of like the back part of the arch of your foot, and those like to get stuck onto each other. So if I just take the muscles of the Achilles and move them back and forth, then I might get them to pry off of those underlying structures. Plantar fasciitis, Achilles tendonitis, all kind of stuff like that tend to be associated with there being some kind of adhesion in these things down here. So I might get very precise and shake and oscillate those. That will create also friction, but the method here would be oscillation. That also could be more specific to a joint. Right? I could just be like, I'm not going to oscillate the ankle joint itself. I could shake the entire limb and shake it so much that I even create rocking forces up into the rest of the body. So it's always a degree of how specific are you being with each method, right? Okay. Percussion. In your classical Swedish massage routines, you have your effleurage, pétrissage, and tapopen. And so effleurage is gliding, pétrissage is kneading, and then tapopen is tapopen. And typically, the flats on the medial side of your hand, just a hacking action. Think you're like karate chop. You can do that generally. As stated last week, I do not use that one a lot. We'll eventually come around to like when and where you'd be more specific, like to wake a particular muscle up, all that kind of stuff. If you wanted to include it in a traditional practice, my suggestion tends to be do your whole routine in prone and then end that with a series of tapopen applications. And if you just like the sensation of it, if you just like, you know, getting some karate chops out, you know, whatever it is, great, sprinkle it in. You can even be more specific, although it would be more in supine. There's systems of like tapopen that use like more tapping. Yet, when I've seen that, it's on the face. Kind of associated with like more of a face-focused massage or even estheticians. That people can do those. Integrates real well because you can do like the little gua sha things, and then you know you can do a whole cool routine with it. But there would make not as much sense to do hacking and stuff like that. The most valuable one that I want to, for a moment, focus on, especially since you know it's going to be cold and flu season, right? In the medical world, where this has more of a focused sense of application, is for cystic fibrosis, where congestion can occur in the lungs, and the importance of trying to just like rattle that gunk free and then move it towards the exit point. The system is shown with what's called cupping, not like your vacuum seal cupping, but creating a cup with your hand to create an air pocket. And then if you want to pick a way to do this where it's more focused for respiration and appropriate breathing, and it can be just somebody's getting over an upper respiratory something, you start low on the ribs, you work your way up between the scapulas, and keep on going in a pattern like that until you're sick of it. Now, a little bit, usually it'll be fine over just one layer of sheet, but if you're worried about it being too slap, because that is a system of tapopen too, is outright slapping. Now, that being done ends up being more about counter irritation or creating a histamine response. We've even seen there's a few spas somewhere, probably in California is one of them, where people go in and they get face slapping. It's like it's really crazy to see. It looks like this crazy, you know, very fast thing. It got popular-ish for a little while. I doubt it's still a thing. But the argument there is just that it creates swelling in the face, so you know wrinkles go away for a little bit. Your face is swollen. Like, sure, that's great. I'll go get slapped for the day, and that'll be my beauty routine. But cupping. So here's slapping. Not going to do that too much. Versus you can hear that air pocket. Okay. Now it has to have some velocity to it. Now this one's worth trying on each other because it sounds like it would be aggressive, it would hurt, but it's actually, especially if you got any kind of, you know, getting over a chest thing, it can be really beneficial. It's got to have that velocity to it. Another place that can be done is right on the sternum. So for self-practice, and I have done that, you know, and just create the air pocket and hit away, and it does work. You'll feel kind of the sense of something shaking free, okay? But that's the one I use the most. Other systems of tapopen that I use tend to be if I'm like going to a one day we'll talk about muscle activation sequences or firing patterns. Let's say somebody has a knee problem. Sometimes what happens there is the calf muscles will start overworking in relation to the hamstrings. And so what I could do is inhibit the calf muscles while doing a dysrhythmic Tepotman application on the hamstrings. The signaling being inhibitory pressure, shush, you shut down, and then stimulatory dysrhythmic application here. So you turn off, you turn on. And trying to kind of get that re-education involved. And that's that. And we will not worry about going through all the modifiers. We will come back around to all this again and again. All of that being said, the predominance that we do will be gliding and kneading. So one part I want to do attached to just this video will be reinforcing some of the body mechanics and stances and things like that, and then we'll go from there. So right from the get-go, draping the area, and you make sure you're looking if you're getting chilly or anything.
Yep.
I promise the heat is a go. I have it to 73. So I drape the area and then this mobilization of the skin. Now, some areas of the body, if you look at that sheet, if you see anything white, the white tarp-like regions, you know, like right by the spine, down at the low back, usually around jointed structures, everything kind of dives down there, and it is going to be less pliable. So the tissue is going to be more pliable over here, just over the scapula, for example, than directly over the spine. It will feel like, especially pulling things away from the spine, it's going to have more bind, less mobility than pushing things toward the spine. And that would be just normal anatomy. We'll have to try to just, it's really important as you're working to get used to how does a body feel. You know, I'll have each other initially as your lab rats, right? When things are fine. What does normal superficial fascia feel like? What does normal muscle tone and density feel like? What does normal passive joint movement, all that feel like? Really making sure you don't just discount that, because when it's not right, it'll jump out more readily for you. So, but that one's a very clear example. When you push toward the spine, easy. That will be the direction of ease for things. When we talk about connective tissue elements versus taking things away, we'll have more bind. So most systems of like myofascial release and connective tissue work will try to start at the spine and work out and away from it, okay? Now that can be done okay-ish here on the upper thoracic to the scapular region. And this is one place where I show something that just feels nice, where going along this whole area, but trying to work more from the spine toward the scapula. So I stand at an angle, and I'm able to just kind of mobilize everything from the spine toward the scapula. It's an area that people usually want extra work on. It's also a means for me to kind of feel and palpate one side to the other. With all this, I can even contact both scapulas, see if one's higher than the other, if one's protracted or over to the side more. Really easy assessments there to kind of feel how are the scapulas moving, how does this tissue feel, and where the scapula's at. All in this action, I can assess and find and identify all that while making it feel like massage, okay? Harder a little bit down here, and it'll be one of the cases where when we talk about the benefit of sideline, once we're into this low back area, to work across and to create that same force is quite difficult. Most of the forces we're going to be applying are going to be going from the lateral side of the body, working medial, meaning we're going to be pushing stuff towards the spine. And by and large, especially if there's no symptoms or anything wrong here, that would be probably sufficient. But in sideline, I want to reinforce that the directions of force keep everything going away from the spine now. I turn someone on their side, now when I push, I'm gonna naturally make contact closer to the spine and work my way out and away. So it's another big argument for using sideline, especially for working here. Let me grab this and I will snag a pillowcase here in a sec. So anyway, even if the arm is just off the side here, and I'll show having it higher up too. Let me just do that now while I'm actually talking about it. Arm up, go. Why am I stuck? There we go. Okay. So we're not into demo territory yet, but just kind of, if we identify the iliac crest, identify the floating ribs, and then know that I have to be somewhere in between, right? So this initial contact of moving the skin, all this can kind of have a quality that feels and looks like massage, but what I'm really doing is, there are the ribs, okay, and then with the outside of my hand, there's the iliac crest. Okay. Ideally, I can kind of even get the sheet right along that line, so then I have a clear sense of where my goal is. Once I've done that and I've already warmed everything up, just a little bit of lotion, right? Just like 1, 2, I mean, we're talking just like a little dollop, right? Then bring in some knees. And with those, I'll slowly graduate the pressure. Just, the first 2 were light, the second 2 are a little bit deeper. Okay, when I come in, body mechanics, all of this, when you see me kind of doing all of this kind of stuff, I'm just getting my body configured, my feet, everything, until I'm robotically set. Back heel down, toes forward, belly oriented, pelvis and my belly button oriented where I'm pushing, my nose pointed, everything, and trusting being closer to your elbow, not here the tip of the elbow, but just over. So if you were to contact here, bring your whole hand over. Most of my massage is done right there, and not out here. And now once I'm here, I get my body sorted, and I've done everything from here, check, that's where the iliac crest is. I can already feel where the ribs are. If we work in this orientation, we're not gonna hurt the ribs anyway, so all I have to really confirm is, where's the iliac crest? And I'm gonna do a pressure check-in. Everyone's just right. Okay, I try to confirm that, and I go, okay, that's the ideal amount of pressure. And now, to create a glide, usually you have to increase your shoulder angle, where you take a little step further away. So if I'm here, my pressure is going to be, the closer your arm, your actual long bone humerus is to your body, the more it's going to be a compression straight down. We practice that one with the make it squash and make it slide with the bolsters, right? If I take a little step away, I'm going to increase this angle, and it's going to create more momentum moving forward. So usually it's going to look like sink in, pressure check, right there. I take a little step further away and try to turn that same pressure now into a glide. I may have to come even a little bit further back. I might have to take a whole step back like this. Now I have more of an actual glide happening. Now I'm going to show, for the most part, really slowing these glides down. Really let 1, 2, 3 glides do the work, not do like 6 of them. Now I have to check in with client now too, as you have all experienced. Some people are going to prefer more that stretchy myofascial sensation, which would be what I'm doing right now. Like I'm slowly moving over the skin, but I am pretty stuck to it and causing more of a tension into that superficial fascia at the same time. So I have to check in with client. Okay. Pressure is good there, yes. Okay. Now, that much stretch on the skin, does that feel good, or would you want more lotion? A little bit more lotion. Okay, perfect. And I clarify, all right, we'll go a little bit. 2 squirts. Apply. So that dance, and then like turn that into some beads. Graduate into applying my forearm. That sinking confirmed compression. I think that's just right. Okay. Okay, let's turn that into a glide. Is that a better slide? Okay. And then we're off. And then once we've confirmed all that, then you can kind of just keep going. Now you'll want to more now than typically moving forward, do these pressure check-ins, and everybody is responsible to confirm, to say, even if not prompted, that you're on like a bone, on the bone too much, if the pressure's too much, too little, if you need more lotion, all that kind of stuff. All right? And that'll be the rest of it.